BW Conversations. Today we're going to speak about medical education in the digital age, the challenges and the way forward. We have with us Professor Moidu. Welcome, Professor Moidu. What is the future of medical education in the digital age?
Your question is one that could take ages to reply, but at the same token, we have all dodged a very serious bullet. That serious bullet came in the shape of a pandemic. And in dodging that, we had a great amount of assistance in better data and information management. So essentially, we are now in a state where we see the need for reforming medical education so our doctors learn and manage the data much better and at a faster pace. Medical knowledge has grown. The human population has grown. The demands of the clinicians has grown. So with everything growing, we need to act, and the act is now. Medical education needs to be reformed so we can train better physicians for the future.
When you say that, what are the challenges that there could be for a country like India?
For a country like India, yes, our population, as we will both agree, is among the largest in the world. Our living circumstances are what they are. And in terms of medical education, we need to be able to bring the education across the nation more uniform, across the nation more advanced, across the nation create lifelong learners. So the first thing in that direction, yes, the government has already started the National Medical Council, the NMC, which is a replacement for the old Medical Council of India. And they have defined very clearly for medical education to progress forward. They have defined lots of competencies a physician or a medical trainee in progress has to accomplish to become that. Key thing that digital technologies allows us is a whole host of resources to enable a uniform platform to learn through YouTube videos or simulations or replay of lectures by professors, etc., so that we can all grasp the subject as it is being taught much better. I would also like to add, knowing the vagaries of technology, in India we will have to work a little harder than the rest of the world because of our geographic spread and the dispersal of resources across the country. We must be able to create not one layer, but 2 and 3 layers of technical backup to ensure there is no lacunae in delivery of the knowledge resources to the student.
When we talk about the benefits of this, of course, it'll, a unified program and learning from various experts, all of that. What are some of the other benefits that you see this would sort of provide?
Especially for a country like India, where we have the tradition of Gurukul, the Guru and the Shishya, that relationship, that active learning engagement, those things are new to the Western societies, but to our social tradition, it has always been there. We need to create jagriti about them. We need to realize that our teachers should not just tell us, we need our teachers to educate us. Educate means we should be able to learn, understand, and more importantly, apply it. Till we can't apply it, it is not good, no good. And that's very essential for medical education. It's a form of effort that requires a whole shift in the paradigm of activity to a paradigm of uniform reactivity.
Given that AI and big data are such an important aspect of medical education today, where are we with them currently in regards to the curriculum, and where will we be in 2025?
I like the way you want to see the future. For me, when I began in the field of medical computing back in the early 80s, what I live today is a future I hadn't even dreamt of then. So, having seen the future in the past, I still think there's a lot going to happen in the future. Let me begin by saying AI and digital technologies. AI and machine learning and big data management, this is such an integral part of our knowledge blocks as we build them when we are taking care of our patients. That tells us the possibilities of what will happen and what may not happen. What are the things we need to look out for and what we can ignore. For those pieces, those rules and roles that we develop, they get formalized into priority generating rules or algorithms. These algorithms are very much today integrated in electronic medical records. So if we were to create a medical education system by beginning the education with a clear understanding of the vocabulary of medical conversation, we would certainly be able to produce better physicians. Not only will we have greater accuracy in the acumen of the people collecting the data, but we will also get better accuracy in the data that is stored for us to generate new knowledge. A patient may have a certain clinical status, and in the hurry to take care of the patient, a doctor could forget it. But that's where a computer, an AI system, and big data management would ensure we should not ignore. Such systems as alerts and reminders are in place in clinical settings in most of the world, and many of the vendors building these digital tools and technologies are in India. We are so commonly engaged in this field of health information technology. It's time we now create rules and regulations that, as part of our education, that we are forced to push and use the technologies by our care delivery providers at the point of care.
My last question to you, what are the challenges of medical education becoming data-centric?
You're now reaching to the point which is my story close to my heart. Because when we talk of medical computing, and my doctorate is in medical computing, I wish to inform you, it's not the technology that matters. It's how we process the data. Technology, we can use it for calculating the structure of a building. We can use the same technology for anything else. But it's that data that distinguishes the processing to be specifically healthcare. And in the past, we used to imbibe the data as if it was an infection, and we were just thrown in the vicinity of a doctor, and we would learn to say, this is superior to, this is inferior to, this is lateral to, this is medial to. this conversation of a specific lingo describing every aspect of the human anatomy as we encounter it in a medical care is a very structured vocabulary. This structured vocabulary is so complex that no single vocabulary can entirely cover all the dimensions of a clinical encounter. The United States government, back in 2010, when they embarked on an electronic health record being obligatory used across all aspects of care delivery, they tried to say, okay, let's have a vocabulary dictionary. And that vocabulary dictionary couldn't be one. So they ended up with 4 data dictionaries to allow people to use different kinds of terminologies that could represent richly the description of a patient in different phases of the examination. So I'm very touched that you have chosen this topic of medical education. I don't think I've touched even the tip of the iceberg. The effort is to create awareness and excitement. I think the NMC has started the path. What we need to do is push the teachers and push the medical council and others to extrapolate and define what's happening. Today, the last place I taught at Hofstra University in the United States, they have a new medical education system where students are put together in a pod, they listen together and discuss all the topics around the topic of their week to see how much does everybody believe we need to learn about everything. So in the 104 weeks, they repeat the anatomy enough times and with each detail enough times to end up understanding not just the normal, but the abnormal and also the care of the abnormal. And this approach to medical education with teachers guiding as coaches and students working hard and developing their learning objectives and their learning curriculum is something we need now because the students are not learning only during class. As medical professionals, you have to be lifelong learners. More important than anything else, the one message I'd like to give everybody is you have to unlearn to relearn.
So great. So you have to unlearn to learn. Thank you so much. It was a pleasure talking to you.
Thank you very much, ma'am. I appreciate your opportunity to chat with you.